Hi everyone, my topic is going to be mental health diagnosis and sexuality. Mental health is defined as a person's condition with regard to their psychological and emotional well-being and their ability to cope with normal everyday stresses. The reason I want to talk about this is because mental health and sexuality are so closely related that we can't even tell what comes first in many cases. Mental health leads to issues with sexuality as well as deviant sexual behaviors, or if what someone thinks is deviant because of society, can lead to mental health illness and mental health struggles such as depression, anxiety, etc. I'm going to be focusing on a micro level, although I think this really comes from a macro level and what society views, but I want to focus on how individuals are going to cope with dealing with issues of mental health and sexuality together. So for circles of sexuality, I want to focus on eating disorders and PTSD as two examples of specific mental health diagnoses, but I think that all circles of sexuality are related to mental health. Body image is one of them that strongly affects sexual relationships because they are not even confident with themselves, and people who are dealing with these struggles have a hard time developing intimate relationships, and sex and sexuality is so, it's very personal, and if you aren't comfortable in your own skin, it's going to be hard for you to have a fulfilling sex life and sexual intimate relationship. And PTSD, people who are traumatized often suffer from anxiety, depression, they are distant from others, and this affects their intimacy in relationships. And this is important because sex is often a major part of people's lives, and if they're dealing with mental health issues, we can't ignore the sexual dissatisfactions that are part of it. From a social justice perspective, a lot of people, the offenders, the sex offenders, they often, they're in society as well, and we have to treat them like we would treat everyone else. And a lot of mental health diagnoses are due to deviant behavior and their sexual disorders, and that includes like pedophilia. And we got to be objective when working with these people, because the only way we're going to help them live appropriate, healthy lives will be by working with them and not judging and giving them fair treatment. This leads into trauma-informed care, where we will also be dealing with victims of sex abuse. And like I said before, this affects their relationships, and we have to be able to work with these people and help them rebuild relationships and feel confident talking to others about their trauma to help them still be able to maintain positive sex lives and feel comfortable about their sexualities despite the trauma they experienced. This can go into communication, because the only way that these people are going to be helped, whether they're the sex offenders, whether they're the victims, whether they're your everyday person with anxiety, we have to be able to talk about this with them, and we have to help them be able to communicate with their partners, because mental health disorders really affect sexual function and desire for sex. And while the people deep down want to be intimate, they're finding a hard time balancing that with their mental health diagnosis. And once their partner can understand this through communication, they can work together to maintain and better their intimacy. And finally, from a parse perspective, is pretty much just objectivity, because one second we could be dealing with someone who we may personally feel so negative about what they did, such as a sex offender, and then deal with a victim, but we can't treat them differently. We have to give them fair treatment, because the only way we're going to do our jobs and help these people better their lives and their sex lives is by being objective and not placing judgment. So that's it. These are my references, and there's going to be more with the paper.